Thank you, Matt. So the case we're going to look at today is of a 90-year-old female who presented with new lethargy and left-sided chest and flank pain whilst at the podiatrist. The podiatrist dialed 999 and requested an ambulance attendance. The patient then described a multi-week history of left-sided axial, rib and flank pain, a 48-hour history of worsening peripheral pitting edema in her legs, and positional shortness of breath. The past medical history included chronic kidney disease, stage 3, an in situ urinary catheter, a history of breast cancer with mastectomy, and osteoarthritis. Shortly after the ambulance crew's arrival, the patient's daughter requested to speak to the paramedic in a separate room. They informed the clinician that following admission to hospital 3 months earlier for pneumonia and hospital-acquired COVID-19, a relapse in the patient's breast cancer had been identified. This had been diagnosed as terminal with liver and bone metastases. The patient had been discharged from hospital 1 week prior. And the daughter states that the patient was unaware of the return of the cancer or of the terminal diagnosis, and they would prefer that it remain that way for the mother's mental health. They also confirmed that the palliative care services were not yet involved due to the short time frame since the diagnosis. However, the local hospice handover was reported as in progress. On examination, it was noted that the patient had upper lobe trematitis with good movement and depth. She was tachycardic and had a News 2 score of 2, but her seating posture was poor and she was unable to hold herself up in the seat, which was likely due to the spinal degeneration due to the cancer. And I'll pause there. Thank you, Bill.
Thank you for that, Antonia. And we're going to pass over now to Professor Bill Fulford, who's going to give an overview on values theory to try and put a little bit of flesh on those bones. Thank you.
Thank you very much, Matt and everyone. As Matt said, I'm going to talk about value theory. I'm just trying to make the screen work. Okay. What you'll see here is that I'm going to talk about value theory, but I'm going to talk specifically about philosophical value theory and values-based practice. There are, of course, lots of disciplines that work on values. And one of the things that's distinctive about values-based practice is that its origins are primarily in philosophy. And I'm going to look briefly at ordinary language philosophy, which is the specific area that has given rise to the work on values-based practice. I'm then going to show you how ordinary language philosophy supports the clinical skills training that is at the heart of values-based practice, and then a brief note on philosophical value theory, ordinary language philosophy, and the rest of values-based practice, and then I'll draw some brief conclusions. So ordinary language philosophy we owe to this man, J.L. Austin, who was White's Professor of Moral Philosophy in Oxford in the 1950s and 60s. What Austin drew attention to was that the way we use complex terms like values in ordinary, by which he meant everyday language, is a particularly powerful way of accessing meanings. Philosophers, as he pointed out, tend to reflect deeply on these concepts, and there's nothing wrong with that. But if we're going to reflect appropriately, we need to also look at how the concepts are actually used. So it's this focus on ordinary, non-philosophical language as a guide to meaning. And one of the best places, Austin himself pointed out, one of the best places to access ordinary language is through case studies. And of course, we've started with a case study this morning. So what do we get from this? Well, this approach expands our understanding. It doesn't give you a complete answer, but it gives us a more complete view. And of course, that means that we get through ordinary language philosophy a more complete view of the values involved in a given situation. And that's at the heart of values-based practice. So I think, Georgette, you've circulated a handout. If anybody hasn't got it, let us know and we can send this to you. And the handout gives more details of values-based practice. I'm not going through this in detail, but essentially values-based practice is like evidence-based practice. It doesn't give you answers, but it gives you a process that supports you in coming to answers, and specifically answers around balancing values in a given complex decision-making situation, such as the one we've heard about so far this morning. You've met Ashok already. As you can see, Ashok is a surgeon, and he's now director of the centre and has been key to the way the centre has developed over the last 5 years, where we've been moving very much from the kind of philosophical theory that I've been involved with right through to the heart of practice in surgery, the Nuffield Department of Surgical Sciences, with our colleagues now in the paramedic professions, and with others such as radiographers, OTs, and people working very much at the coalface of medicine. So it's an exciting area for philosophy to be playing out in. This is a little bit more detail of the process of values-based practice. As you can see right at the top there are 4 areas of clinical skills. Again, this is all in the handout, which we'll be glad to send to you if you haven't had it already. So how does this ordinary language philosophy as the basis of values-based practice support clinical skills training at the top there of the process? Well, the aim of all these elements of clinical skills training is to raise awareness of values. And as you can see, it's also about the surprising nature of value. There's lots of ways we do this. We haven't had time to do any of these exercises this morning, but you'll find them in all our published materials, the 3 words exercise, force choice exercise, and then close reading of texts, in particular as they come from clinical stories. And not just clinical stories, but everybody's stories. We've already seen with the case this morning that that Antonia presented to us, that it wasn't just the patient's values that were in play, it was her family's values, and of course the clinician's values, and we'll hear more about how that plays out as we go through the morning. I'm going to tell you a different story which illustrates the importance of what we frankly haven't been able to do today, which is to try these exercises for ourselves. This is called the story of Dr. Zoe Barber's surprise. This is Zoe and her partner, now husband, Tom. I should say that Tom and Zoe have published this story, so we're not revealing any secrets about their lives, but they have published this story, and it brilliantly illustrates the importance of the practice of values-based practice. So Tom and Zoe were both very high-powered young doctors when they got involved with values-based practice. Tom had been a prize-winning medical student at Oxford. Zoe has since gone on to get, I think, Ashok, it was the gold medal as the best candidate in last year's surgical exams. So both very bright people, and Zoe in particular had been very interested in values and ethics, and she'd read all the literature on values-based practice, but she'd never actually done this force choice exercise for the first time. And the force choice exercise involves choosing a minimum period of time that you would want, and that minimum period in the exercise reflects your values. So when we did the first surgical seminar, I got Tom and Zoe to sit in the circle with our colleagues and to do this exercise for themselves. And when we got to the point of choosing these values, I could see there was a bit of discussion going on between Tom and Zoe. And I went over and I said, "What's up with you two?" And Zoe said, "Well," she said, "Tom chose 6 months and I chose 25 years. And she was obviously very upset about it. And then she wanted to explain that actually we're getting married in 6 months. And she, afterwards, when she wrote about this, she said, "As I said that, I realized that what mattered to Tom was finishing his PhD. That was his values, that was his top value, whereas I'd been thinking about having a family." And she went on to explain, if I could have so misunderstood what mattered to the man I had known for 6 years, they'd gone through medical school and being young doctors together, and they were about to get married, what chance have I of guessing what matters to the patient that I met 5 minutes ago? So it was a light bulb moment for Zoe, that even though she'd read all the literature, she knew the significance of values and of the surprising nature of other people's values, for her to actually do this exercise with Tom and realize that although she'd known him for 6 years, she'd still misjudged what was going to be important to him in that decision-making situation. So we really need to train, we need the skills training to find out what matters to our patients and colleagues in decision-making situations. So that's the skills training that is at the heart of values-based practice. There's lots of other aspects of values-based practice where ordinary language philosophy is relevant. And again, I won't have time to go through these in detail, but it includes the model of service delivery, which is about multidisciplinary care and person-centered practice. It includes the three strong links between values-based practice and evidence-based practice. And it includes this model of dissensual partnership in decision-making. Dissensus is a bit like consensus, but it just means that nobody has to give in. We'll see how important this is in the case study as we work through it. So a final point is that ordinary language philosophy supports the premise of values-based practice. This isn't in the process, but it underpins the process. And the premise is that essentially everybody's values are important. So this is ordinary language philosophy as it impacts on values-based practice. One of its other features that I personally find particularly attractive is that it's not an exclusive way of doing philosophy, but very much a partner to other methods. And we'll see how important that is later on when we see we'll be looking at law as it impacts on our case. And law is, of course, part of the values toolkit of healthcare, as is ethics, and values-based practice fits in with that. Some of you may have come across the decision aids that are being produced for some areas of decision-making. These are based on decision analysis, which is a sort of mathematical way of looking at values. Health economics is similar. And then there is a whole range of empirical methods that we get from psychology, anthropology, and other similar areas. So think of values-based practice as one of the tools that we need in our toolkit for working with values. And perhaps the most important of the other tools, interestingly, is evidence-based practice. And I've shown that diagrammatically here. You remember there are three strong links between values-based practice and evidence-based practice, and they are partners, particularly in this shared model of clinical decision-making, where clinician and client or patient come together and make a shared decision about the best way forward. Of course, we haven't time to go into that in detail today and all its complexities, but that's very much where the toolkit comes to absolutely the top of our priorities. That it's not that values somehow are against evidence. It's not that evidence has to be used or values have to be used only where we don't have evidence. They're very much full partners in shared clinical decision-making. The other area of partnership that ordinary language philosophy feeds into is other philosophies. This is one of our colleagues in the Collaborating Centre, Verdi van Staden, who is the Nelson Mandela Professor of Philosophy and Psychiatry at Pretoria Medical School in South Africa. And he's been developing a whole approach to values-based practice based on African philosophy, which he's calling Bathopili. Very powerful, and particularly in the kind of decision-making situation that we've talked about in our case study, where it's not one or two people involved, but a community of ideas from a family or from the health and care professionals. Another important area that some of you may have already touched on is phenomenology. Traditionally, phenomenology and analytic philosophy of the Anglo-American school have been opposed, but they are increasingly coming together in the 21st century, and this has been a powerful resource for values-based practice. Phenomenology, understanding the life world of the person concerned, and I've illustrated here with the work of our colleague in Italy, Giovanni Stangolini, on eating disorders, and our colleague in Brazil, Guilherme Mezas, on addictive disorders and alcoholism. But analytic philosophy itself, which is the Oxford tradition, also has new resources for us. This is our colleague Anna Bergqvist, who works in Sweden and the UK, and she is the theory lead for values-based practice. And she's been working on analytic philosophy of values, and in particular, the way in which relationships underpin, personal relationships underpin the way, the values that we adopt and develop. We've also got more theoretical areas. two colleagues here, Colin King, working in critical race theory, and Colin has an important webinar coming up on 27th of October to tie in with Black History Month. And he's been doing some crucial work in the way that critical race theory feeds into values-based practice in the area of particularly mental health and race relations. And then Philip Corrales on the right here, who is, as you can see, the Fulford Clarendon Fellow at St. Catherine's College. He's been working on the very abstract area of semantic logic and how that feeds into decision-making. So some brief conclusions. We've looked at ordinary language philosophy and values-based practice. As this indicates, values-based practice is based directly on ordinary language philosophy, which employs our everyday, ordinary, or non-philosophical uses of language as a lens to reveal meaning. And the way that lens works is to expand our understanding. So the ordinary language philosophy helps us to see more of the values that are in play. That underpins the way ordinary language philosophy supports the clinical skills training at the heart of values-based practice. I've mentioned the 3 words exercise, which is directly aimed at helping us to see more values. The forced choice exercise, where we see the link between values and evidence. And from the story of Dr. Zoe's surprise, you see how important exercises of this kind are, even to those who've been through all the theory. So we haven't had time to do that in our 2-hour seminar, but this is why, as Ashok said earlier, it's so important that this work is in the paramedic curriculum. It's all about training, practicing it, doing it for yourself. I then ran briefly through how ordinary language philosophy supports the rest of values-based practice, right through from its premise to the core concept of dissensus in decision-making, and the way in which ordinary language philosophy encourages partnerships with other areas of expertise. I mentioned in particular evidence-based practice and how that fits in with the values toolkit and the range of empirical methods that we can bring to bear alongside the philosophical value theory. And there are, of course, these other philosophies. I touched on African philosophy, phenomenology, critical race theory, and semantic logic, and not last but not least, other areas of analytic moral philosophy. So it's quite an agenda. And I want to finish with this image of some of the people that I've shown you today. There's 1 or 2 on here that I haven't managed to touch on this morning, but what you see is that this is the next generation of values-based practice. My apologies, there's none of our colleagues from the paramedic field on this slide. It was made for me by someone else and I wasn't able to adapt it, lacking the relevant technical skills. But what's so exciting about the whole field is that it's the next generation that's really carrying things forward. The next generation of very bright, younger people from very diverse backgrounds. And you know the famous byline for the Star Trek series, to boldly go where no one has gone before. And it's the next generation that I believe has to boldly go, exploring the philosophical and other areas of theory that will support the effective development of values-based practice. Thank you very much.